Thanks for the command. A young man sitting comfortably on couch, well cooperative during examination. On clinical examination of the lower limbs, there is an well-defined, regular in shaped oval uh, military ulcer present over the medial aspect of the right lower limb, just a few centimeters above to the medial malleolus. The size is 3 into 4 centimeter in its largest diameter. It is non-tender of normal temperature as compared to the surrounding skin, and it is attached to the underlying tissue. The margins are hyperpigmented to violaceous and they are indurated. The edges are sloping and the floor is covered with granulation tissue, and there are also few areas of purulent discharge present over the surface. The base is attached to the underlying tissue, and the surrounding skin is hyperpigmented, indurated, and with relative loss of appendages, which is more marked over the inferior aspect of the ulcer. There are few superficial veins which are present, which are evident over the dorsal aspect of the foot. Then I will examine the other parts of the leg as well, and there are two atrophic plaques present over the anterior aspect of the leg. The largest one is of size 6 into 7 centimeter in its largest diameter, and the smaller one is of 1 into 3 centimeter in its diameter. The skin over the plaque is atrophied, shiny, and wrinkly. With loss of hair over the plaque. Then I will examine the other leg for the similar kind of ulcer. And then we'll examine the plantar aspect of the both feet. We'll examine the nails. We'll interdigital webs, and we'll palpate the dorsalis pedis and posterior tibial arteries of both feet. Then we'll ask the patient to do passive movements, to do active movements, in fact, over the joints or the ankle joint, and then we'll check for the pedal edema. And if it's present, then we'll check the extent of the pedal edema. We'll examine the popliteal and inguinal lymph nodes. Then we'll examine the face for to see the signs of diabetes mellitus, like the eyes for the pallor and the periorbital puffiness, and then we'll ask the patient to swallow to see any enlarged thyroid gland. Then we'll ask the patient to do joint movements of the hands to see, and we'll see any kind of deformity. Then we'll palpate the lymph nodes of the cervical and axillary region, and then we'll palpate and examine the gastrointestinal tract for any visceromegaly. And at the end, we'll ask the patient to stand to see any varicose veins of the both limbs. On the basis of my examination, my first differential diagnosis is venous ulcer, and due to its location over the medial aspect and the lipodermatosclerotic changes more pronounced over the inferior margin, and varicose vein and dilated veins evident over the dorsal aspect of the foot. And my second differential is Pyoderma gangrenosum due to the atrophic scar present over the anterior aspect of the limb. And as it is I have kept the Pyoderma gangrenosum as my second differential because it is the diagnosis of exclusion. That's why my first differential is varicose ulcer, of the venous ulcer. Thank you.